I really want to welcome everyone here to this highly auspicious occasion. I want to thank everyone for being here. This is certainly an exciting day as we break ground on our new Center for Medical Education here at the LSU Health Sciences Center in Shreveport. We also celebrate, importantly, the accomplishments of Ochsner LSU Health Shreveport that have occurred since our partnership was announced, Warner? A little over a year ago, a year and a couple days ago. I would first like to introduce those sitting on the dais, all of whom you'll hear from momentarily. On the dais, the Governor of Louisiana, the Honorable John Bel Edwards. This governor's been here more than any governor in the 25 years that I've been in the great state of Louisiana. Secretary of the Louisiana Department of Health, Dr. Rebecca Gee. Mayor of Shreveport, the Honorable Adrian Perkins. Senator Greg Tarver, Louisiana Senate, District 39. Senator Francis Thompson, Louisiana Senate, District 34. Representative Sam Jenkins, Louisiana House of Representatives, District 2. Representative Katrina Jackson, Louisiana House of Representatives, soon to be Senator, District 16. These are the senators and representatives which our two major hospitals in Shreveport and Monroe reside. That's why I have selected them to make small comments this morning. President of Louisiana State University System, no other than Dr. F. King Alexander. Last but certainly not least, very instrumental in our joint venture and the current success of our School of Medicine and all of our schools, President and CEO of Ochsner Health System, Mr. Warner Thomas. Before we have the speakers make comments, I would like to just recognize a few of the dignitaries that are seated here today. Joining our legislators that are on stage, Representative Barbara Norton, Representative Larry Bagley, Representative Wayne McMahon. Representing the Board of Regents of our great state, Regent Claudia Adley and Regent Wilbert Pryor. Representing our wonderful LSU Board of Supervisors, Chair Mary Werner, Mr. Remy Starnes, Mr. James Moore, Mr. Wayne Brown, Ms. Valencia Sarpy Jones. Representing Caddo Parish Commission, President Stormy Gage White, Stephen Jackson, Lewis Johnson, Lyndon Johnson, Mike Middleton, Mario Chavez, and Administrator Woody Wilson. Thank you for being here. Representing Shreveport City Council, Chairman Jerry Bowman Jr., James Fleury, and Lavette Fuller, as well as Reverend James Green. Thank you for being here. Representing Bossier City Council, Jeff Free and Jeff Darby. I see several members of the LSU Health Foundation. I thank you all for being here, and I also, in particular, their chairperson, Katie Merriman. Thank you for being here, Katie. You're somewhere there. Representing the Ochsner Health System, Mr. Pete November, Dr. Butch Adolph is not here, but he's been very, very important. Mr. Chuck Daigle, and really the entire OLHS of North Louisiana team. From the bottom of my heart, I thank you for all the hard work that every one of you have done. The OLHS, the Ochsner LSU Health System Community Board, has been really phenomenal. And I see most of them sitting right here. Ms. Jacqueline Scott, Dr. Carolyn Hunter, Pastor Timothy Jones, Mr. Steve Scrivanis. Thank you guys for what you do. And last but not least, I want to thank my LSU team, which includes not only all the faculty, employees, and students, but in particular, my vice chancellors, Jane Eggerstadt, Chuck Fox, Jeff Reynolds, Lester Wayne, the vice chancellor and dean, Dr. Chris Kevel, and dean, Dr. David Lewis, Dr. Sharon Dunn. You guys are amazing. I thank you very much. Without further ado, I would ask that the Honorable Mayor Adrian Perkins welcome everyone to Shreveport.
Good morning, everybody. I almost said good afternoon. I had to correct myself. I lose track of time in this job. But I want to thank everybody for coming out. Dr. Ghali just did a great job at recognizing our local leadership, our state leadership, but also we just need to recognize the citizens of Shreveport and the citizens all around the state. This truly is a joint effort that has us here today, and I'm just grateful to be here to bring greetings on behalf of the city of Shreveport. First, I'd like to thank Dr. Ghali again for his steadfast leadership here. The unwavering dedication of his staff makes LSU Health of Shreveport second to none. It's truly a world-class institution that supplies Shreveport's healthcare industry with well-trained medical professionals. I also want to thank Governor Edwards for keeping his campaign promise. He promised that on the campaign trail that he would fight to keep the medical school right here in Shreveport, and he did just that. As a politician, I know firsthand just how hard that can be. So for him to remain steadfast in that means a great deal to us and our community. This is a huge part of our local economy. Healthcare is the leading industry in our area, and Shreveport is the healthcare hub of the Arklatex. This new center of medical education is a welcome and much needed addition to our healthcare corridor. This expansion will increase the number of students at LSU Health, Shreveport, and Contrain, meeting a critical demand in our area. This is a good day for Shreveport, Northwest Louisiana, the Arklatex, and thanks again to Governor Edwards, Dr. Ghali, and the entire LSU healthcare staff and the citizens of Shreveport. Thank you.
Thank you, Mr. Mayor. Before I invite our governor to say a few words, I just want to make it clear to everyone that this couldn't have happened without Governor Edwards' hard work, combined with the hard work of the entire legislative team. I will tell you that he stepped in when LSU Shreveport needed him the most by helping us bring a strong partnership in with the Ochsner Health System. And I think that this building is sort of the icing on the cake of that partnership and what we've been able to do. So I don't want to waste any more time. I really want to get the governor up here, the Honorable John Bell Edwards.
Thank you. Good morning and thank you. What a great, if unseasonably warm day in October to be here with you in Shreveport, Louisiana, to celebrate some more exciting progress from Ochsner LSU Health Shreveport. You know, it was about a year ago that we were here to announce the partnership between Ochsner and LSU. And I told you then, that I believed that in short order, we would absolutely stabilize the medical school, deliver the best health care possible out of University Hospital. But then over a short period of time, we would strengthen and grow as well. But even I then didn't realize that just 1 year later, we would be back here celebrating a groundbreaking like we are today. You know, the mayor shared this with you a while ago. I've always been committed to making sure that the medical school stayed here in Shreveport and that it would be stronger, bigger, better than ever. And we came together with many of the people you see here today to deliver on that promise. And today we're announcing that a new building, the Center for Medical Education, will be built on this campus and will serve as a state-of-the-art training facility for tomorrow's healthcare workforce. Now that's exciting to me. And everybody here really made it possible. And I do want to thank everybody, and I don't want to start calling names because I know that I will leave people out, but I do want to thank in particular the legislative delegation from Northwest Louisiana who put this squarely on my radar many, many months ago. And my commitment was, as soon as we turned around Louisiana, created the stability that we needed, made sure we had the capacity within our capital construction program, that we would move forward. And I'm happy to be here to do that because the LSU School of Medicine has been in the same building since it was created in 1975 with 30 students. Think about that. Today, the School of Medicine has 150 students, up from 120 last year, right? Up from 120 just last year. And there's been 100 faculty members recruited over the past year as well. So obviously, the current facility was way past its prime, and we needed a new investment in the LSU Medical School. And today's groundbreaking goes to show that the partnership between LSU Health and Oxnard, and I want to thank Dr. Ghali for his leadership, and I want to thank Warner Thomas for his leadership, and everybody at LSU and Oxnard for doing exactly what we predicted a year ago. We've strengthened the medical school, we're growing it, we're expanding it over time to provide better health care than we've ever been able to provide in North Louisiana, but really not just North Louisiana. In my small hometown of Amite, there are 3 doctors who went to school here at LSU Shreveport, which is a strong indicator to me that what this school does is important to everybody in the state of Louisiana. And I don't want to just single out the doctors because there are a lot of other allied health professionals who graduate from LSU Health Science Center in Shreveport every single year, who then go out and do great work across the state of Louisiana. This is not the first sign, by the way, that we've gotten that this partnership is a success. It was recently announced that LSU Health Shreveport was recognized as Louisiana's very first pediatric trauma program. That is quite an accomplishment, too. Everybody here understands how important this school is to the health care for Louisiana, Northwest Louisiana, but you also understand how important it is to the economy up here. And that's why you're here today. And I am so gratified to see so many people come out to celebrate what is truly worthy of celebrating. You understand how important this school is to this community and how important this hospital is to this community. People from all walks of life depend on the services provided here, and the most vulnerable members of our society get their health care here. That is a noble calling. That is quite literally doing the Lord's work in Matthew 25. Without preaching today, because I shouldn't do that, but that is how important this work is, and that's what it means to me and to citizens all across the state of Louisiana. Another reason why it's important is because we're making an investment in our students. For the first time in a decade, we actually have turned the corner, and there's a net new investment in higher education all across the state of Louisiana this year. And because we righted the ship from that $2 billion deficit that we had 8 years ago, we actually have the ability to start investing in critical priorities like we neglected for over a decade. And that's what brings us here together. And it's these types of investments that really give us, I think, a sense of optimism about our future, because we're investing in Louisiana's people so that they can stay right here in Louisiana and provide world-class health care, but also contribute to the economy, make sure that they can support themselves and their families. And I'm excited for the future doctors. And I'm excited for the future doctors, nurses, and medical professionals who will learn how to save lives and improve lives all across Louisiana. And when you take this $60 million investment and you put it with the $40 million investment in the St. Mary's facility, that means we have $100 million being invested in this medical school right now. That is just so far removed from the reality that we faced just a few years ago that I just cannot help but be excited about the future of our great state and this medical school. So thank you for coming out today and celebrating with us. And the only thing more exciting to me is what I know we're going to be able to do over the next 4 years. God bless you, and thank you so much.
Thank you, Governor Edwards. I would like to invite Mr. Warner Thomas, President and CEO of the Ochsner Health System, to speak about the accomplishments of Ochsner LSU Health Shreveport over the past year. Warner, thank you for being here.
Well, good morning, everybody. What an exciting day. What a great day to be with you here in Shreveport. And before I jump into some of the accomplishments, and frankly, we don't have enough time to go through all the accomplishments over the last year, but I'm going to hit a few highlights. I do want to give a few thank yous. I do want to thank Governor Edwards for his focus on health care, expanding Medicaid in the state of Louisiana. And for focusing on investing more in health care. We have not seen one rural hospital in Louisiana closed, and I can tell you it happens in other states all the time. And because of the expansion of Medicaid and more funding in health care, that has made a huge difference. So Governor Edwards, thank you. I also want to give a big shout out to the LSU Board of Supervisors. You guys took a bet on us a year or so ago, and we told you that we would deliver. And hopefully you feel good about kind of where we are today and what's moving on. But I appreciate the vote of confidence in Ochsner to come and partner with your folks here in Shreveport. Thank you very much. And I want to give a big shout out and thank you to the Ochsner LSU Health Board members. See several of them sitting here. They've worked tirelessly with us over the last year, helping to guide us, giving us feedback, helping us think about how we make the right choices, and really have been very, very committed to the success. Thank you so much for your great work. Really appreciate it. So we made a commitment to you over a year ago to improve access to health care and to improve quality of care here in the community, and we're going to give you a few comments about that. We talked about our intention to also increase education and research, and this medical school building is just one step in that direction. As I was saying to folks earlier, there's a lot of things that happen, but we're just getting started. We've only been here a year, so we got a lot more to do going forward. In the first year, we've invested with our partners at LSU over $73 million in facility and equipment across the system, including the $40 million that Governor Edwards mentioned in the Ochsner LSU St. Mary facility, the former Shumper facility. Just bringing that facility back makes us proud to be part of what's happening in your great city. And I think it's an indication of great things for the future. But there's a lot more that we have to share with you. If you think about healthcare, we always talk about quality of care, but the important thing is access. You can't have great quality if you don't have access. And we worked together with the team here at LSU and have been working to improve access across the region. We're opening up opened up our new primary care clinic last month, and there are plans for 2 new urgent cares in the community in Shreveport and Bossier. We're opening up 2 more primary care clinics, one in the Hollywood community and one in the Cedar Grove neighborhood, to help serve those that are more vulnerable and need better access to health care. We've also worked hard to improve access across all the departments. Working with Dr. Fox and Dr. Lewis and the team here, we reduced wait times by 40% across the departments on average. Many of those are actually higher than that. Yeah, give them a round of applause. They've done the great work. In the outpatient area, we've seen 22,000 more visits, and as Governor Edwards indicated, we've hired, actually it's over 100 faculty now. It's near almost 120 new faculty, new physicians coming to the community. And if you had asked me a year ago, will we hire 120 folks? I would have never thought so. But the incredible work that's going on here with the team on the ground, they've done amazing things. So let's give them a big thank you, a big round of applause. But it's not just access, it is about quality. And I think one of the things we said we would bring is some of the systems at Ochsner to improve quality. We've seen falls on our nursing units reduced by 22%. We've seen infection rates across the system reduced by 50%. And we've reduced risk-adjusted mortality by over 10%. So this is the great work that's going on and really focus on expanding. We also are working in the pediatric area to expand care in pediatrics. And it will be the state's first pediatric trauma program right here in Shreveport, taking strides to take care of the most critically ill people. In Monroe, because we don't want to forget about our friends and our colleagues in Monroe, we've opened a hybrid operating room in Monroe. We've built new capabilities from a clinical perspective. We've implemented what's called the Ochsner Tele-ICU, which allows us to monitor intensive care patients remotely. We've actually reduced significantly the amount of people that had to leave Monroe and come to Shreveport for ICU or critical care, keeping people local because local care is best care. So Lester Wayne and the team there, thank you so much for what you've done to help us out. And finally, our people. You cannot do any of this without people. It starts with a great workforce. Over the past year, we've grown the workforce by well over 100 people. We anticipate growing the workforce by 200 people this coming year. We moved the minimum wage across the Ochsner LSU Health System to $12 an hour to match up with what we do at Ochsner. And that impacted several hundred people who got that raise day one. Actually, not day one. I think it happened in April, so I want to correct myself there. Got excited, And then we're really proud to announce the investment in the LSU Health Shreveport Center for Medical Education. Ochsner's committed $5 million to that project. The Ochsner LSU Health Board and the joint venture here is putting $2.5 million in it. So that's $7.5 million towards a $60 million investment to pair up with the state funding that's coming. So I want to thank the governor and I want to thank the legislators for what they've done and how they've supported us. And many times, if you're a government official, you get criticized for doing things and whatnot. But I always say to people, if you don't like what they're doing, then go try to do their job. See how it works. I mean, we should thank them for being public servants, for putting their time in, because I can tell you, it's a very, very difficult job. And finally, on behalf of the Ochsner Health System Board and the Ochsner LSU Health Board, I want to say thank you to the leadership team here, the physicians, I see many of them standing here, the medical students, the residents. We could not have done any of this without you guys. You are the ones that make it happen every day on the line. So let's give all those folks a big round of applause. A lot of them right back here. And then finally, I do want to give a shout out to a couple of folks from my team. Pete November, who is one of our executive vice presidents at Ochsner. I can tell you, this deal with LSU Shreveport would not have happened without this guy right here in the front row. So he's the guy you should thank. And then the great team we have here, Chuck Daigle up front, Dr. Lewis, Dr. Fox, Dr. Ghali. I mean, they've done amazing things. So we're just getting started. We look forward to the next year and coming back and celebrating a whole list of new accomplishments another year from now. So thank you very much.
Thank you, Warner. I would like to welcome Secretary Rebecca Gee, who's been a strong supporter and advocate for improving health care in North Louisiana and throughout our state, and was recently here giving a grand rounds. Secretary, Madam Secretary.
Thank you, Dr. Ghali. As Secretary of the Department of Health, my job is to oversee not only the Medicaid program, but hospital licensure and our GME programs. And I can tell you that my boss, Governor Edwards, that my very first meeting in this role was with King Alexander and with him and talking about this med school and what were we going to do. Because 4 years ago, frankly, the picture was not as rosy as today. And I'm proud to say that he was committed to making sure that not only did we improve the medical school, but we grow it and make sure that it thrives. And today we're here to celebrate the incredible success. It's a testament to Governor Edwards, first and foremost, and to the Medicaid expansion that's ensured that we have an ongoing way of paying for Medicaid and indigent care for our state, but also to our legislative delegations, both Northeast and Northwest, who tirelessly advocated to make sure that we grew this medical school and made sure that it thrived. To our clinical leadership, Dr. Lester Wayne Johnson, Dr. Fox, David Lewis, and Dr. Ghali, who made sure that all through this transition that we invested in quality. And I had the pleasure a month ago of being both at in the East, and it's LSU. Now you have to give me the new name for Conway, Dr. Lester Wayne. But I was at your facility and here, and we went over metric after metric. And I'm so proud to say that on every single metric, there's been improvement. Every single one, whether it's a 47% decrease in transfers from Monroe to here, because you can now take care of patients where you are and improve the quality of care, or it's deaths, preventable deaths in surgery, or it's improvements in obstetrics. Dr. Lewis is leading the state in quality improvement for our moms and our babies. Or it's wait time decreases that lead to better outcomes, less infections, and so on. And on and on. There is so much to be proud of. But most importantly, patient care has improved. Not only have wait times decreased, and Warner told you about the 22,000 increases in outpatient visits. And isn't that an extraordinary number? 22,000 more people have been able to see a doctor in Shreveport. A 40% reduction in wait times, and that means it used to take 6 months to see a cardiologist, now it's 1 month. It used to take a month to get a primary care visit, and now it's 1 week. It used to take 360 days to see an infectious disease specialist, now it's 3. Think about that improvement, but most importantly, we've saved lives. If you look at surgical mortality, and that is tremendous. That is a tremendous decrease just in 1 year. But today we're here to celebrate not only the lives saved, not only the quality improvements, but our students. This is an investment in growth. There were fears initially maybe we wouldn't grow the med school. Look, already 30 more students, and by the end of 2023, we're going to have 200 students per year in this medical student class. And we know that most of those students will stay here and practice here and be the doctors of the future. So this is an investment in our future, and we're so delighted to celebrate this extraordinary day, this new horizon for what is going to be a beautiful building for our students to enjoy. So congratulations.
Thank you, Madam Secretary, who changed her entire schedule for the week to come here on short notice. Thank you. I would like to invite LSU President Dr. F. King Alexander to the podium and to offer thanks on behalf of every employee and student on our campus for his steadfast interest and support in our Health Science Center. Thank you, President Alexander.
Thank you, Chancellor Ghali. When I look at this crowd, I've been all over the state. We have ag centers in every parish, so we're all over the state. LSU is all over the state. But this is the hardest group constituency in the state to convince. Because for 6.5 years, every time I've spoken up here, I've told you we're not moving to med school. And within 3 months, I'd hear another rumor coming out that we're moving it to Baton Rouge, or we're moving it to Lafayette, or we're moving it to Bunkie or Mamou. We have been committed to helping this med center grow because of the needs of this region. And you've been committed to making sure the needs of this region are being met with health care. And this facility, in many ways, says it all. It's a medical education center and health center. And Thomas Jefferson said, health is worth more than learning. But learning, you can't have learning without health. That's why this center, that's why this new facility is so important. For the health of the region, for the health of our employees, for the health of our staff, for the health of our students, and for the health of the region, but also for the education of the region and medical education. This wouldn't happen today if it wasn't for a team of people and a team of leaderships. And I'd first like to thank Governor Edwards for his leadership and his commitment to building, getting us to this day. Governor, thank you. I'd like to thank Warner Thomas and Oshner for making this happen. 1 year later, look at what's happened. 1 year later. I'd like to thank Commissioner Gee for her steadfast support of making sure that this region was getting the health care that it needs, and that we are producing the doctors, nurses, and other health care professionals that this region, northern Louisiana, and this whole Delta region needs. I'd like to thank the state legislators who are in front of us and behind me. Many of those state legislators were the ones that called me into their office and said, "What is this rumor about moving to medical school and moving to a medical center?" But all of them behind me have made this happen. This was indeed a team effort. I'd also like to thank the generosity of the donors. And at noon today, we're kicking off this portion of Fierce for the Future, because this facility wouldn't be possible without a 50-50 match. The governor's put in $28 million, and we already have donors who've supported us with $11 million on our way to $28 million right here for this facility. There's another individual I'd like to thank, and it's indicative of what we all do. And Stuart Lockett is standing in the back over here. Stuart Lockett is a first-year medical student here. What most people don't know is Stuart Lockett was on the Board of Supervisors when we made this deal with Oshner, and we went forward and we were committed. And without Stuart as student government president in Baton Rouge, as an undergraduate leader, this is how it's supposed to work. We educate top-quality undergraduates that then come to this great medical school and then stay in this state to help the health care of this entire state. I'm so glad we're now, all of us, being able to talk about not moving anything, but growing something. Growing something, doubling the size of this freshman class. When I got here 6 years ago, we had 100 in that entering class. Now we're going to have 200. But more importantly, Stuart Lockett was representing 9,000 medical students that are up here each and every year. And that's going to grow with this new facility. We're going to grow, and we're going to meet the needs of this region even better. And with our great staff and faculty, they're all committed to this, and know that we're committed to growth. We're committed when we move that dirt. I don't want to hear another word about moving anything. So thank you for all your support, and know you've got our support to make this the biggest, best medical center in this whole region of the United States. Thank you all very, very much.
Thank you, President Alexander. We'll now have just a few remarks from the legislators that represent the hospitals in their respective districts. I would like to start with Representative, soon-to-be Senator Katrina Jackson.
Let me start this off with thanking first the governor, who has been a tremendous support system for us in Northeast Louisiana, especially when it comes to LSU Medical School, our partnership hospitals in Monroe and Shreveport. I'm not speaking loud, and usually he says I speak too loud because I'm always screaming before I get into his office asking for something. But he always says that. He says when he sees Senator Thompson and I coming from Monroe, we're going to ask for twice as much as other people with that have twice as many people as us in their districts and in their area. But with all seriousness, this governor has been phenomenal for us and for you, for our partnership hospitals, for our medical schools across the state. His commitment to medical education and his concern and his robust knowledge of the issue has made engaging and advocating for our constituents a pleasure. And so again, I know you've given him a hand. I'm going to ask for another hand because we've begged him. And then to the North, I always say Northeast, but North Louisiana delegation as a whole. what these ladies and gentlemen do, regardless of whether we're standing on stage together, regardless of whether we're in the audience right now or in our districts campaigning. The one thing that we've always had in common across the North Louisiana span is LSU Medical School and our partnership hospitals. You bring us together like no other issue that spans across North Louisiana. And for that, it has been a great pleasure serving with the members of the legislature. And let me say this lastly, because there's a lot of people to speak. One thing that I have found to be very important with advocating for us is that we have consistency in leadership at home. And we have people that we can continuously contact, and we don't have to re-educate them and bring them up to speed. Dr. Ghali, thank you so much. You've been that for our medical centers. You have. You have. And President Alexander and everyone knows that when it comes to North Louisiana, we're going to all have in common our support for this medical school, for our partnership hospitals, and for Dr. Ghali and for Dr. Pierre, who comes down every day with us advocating for you. But the consistency and leadership and advocacy is so important for us. You guys just don't know how important it is. We don't have to start on day one explaining what happened last session. We come in every session, and the governor knows we're going to come into his office, and we're going to beg for the medical school and our partnership hospitals, and he's made it easy for us and for you. And I want to thank everyone for making this job of representing North Louisiana easy. Thank you.
Thank you, Representative Jackson. Certainly, as Representative Cheney and I once said, when he said we were connected at the hip between Shreveport and Monroe, no, I'm sorry, Mr. Representative, we're not connected at the hip, we're connected at the heart. And so thank you very much. You're not next, not you. Thank you. I'd like to now call Representative Sam Jenkins to make a few comments, please.
Well, good morning. They tell me it's only about 30 seconds left for speakers. And I got to split that up with the rest of these guys, so I'm going to be quick. You know, it's just very pleasing to see so many friends and supporters of our medical school and of our hospitals here this morning. And I think that is a reminder to all of us who may be at the state level and legislature, or whether you're leadership at the university or at the medical school or at the hospital, that really the commitment starts with you guys coming up. It really, really does. It's important to have our local governmental officials as well as local boards and community organizations in support of what we're trying to do here with our medical center and with our hospitals. So thank you so very much for your support and for everything that you do out there day in and day out to make this work. I don't think that we should look at the day as an end. I know that we're celebrating accomplishments, but let's not look at this as an end to anything. This is going to be a beginning of a commitment by all of us to make Northwest Louisiana the medical research, medical delivery of service center, not only of Louisiana, not only of the United States, but around the globe. Are we together with that? Thank you so very much, and let's continue our commitment for our community. Thank you so very much.
One of Louisiana's most tenured and revered legislators with an incredibly long track record of support. Y'all quit looking at each other. Come up here, Senator. Senator Francis Thompson, I can tell you this man has no peer.
Thank you so much. It's such a pleasure to be here today. And usually I talk at least 35 minutes. Most often I speak an hour. But with everything already been said, I won't repeat it more than one more time. But I'm the chairman of the Northeast delegation, and I've served in the legislature 45 years. So, and I hope to be here another 20. But with that being said, I wanted you to know that a little bit about the history of this. We from the Northeast group, as we talked about it the last couple of days, we wanted to bring you good tidings from we that live on the other side of I-20. And we support LSU Shreveport just like we do Conway and Monroe. And as I look back, it's never been so good. And I need to thank a few people. The first one I would thank is the governor. None of this would happen without his hard work, dedication. And the attitude he has, he never gives up. He's looking for the best alternative. And we've got that. And I want to compliment Warner Thomas and their partnership group. Thank you so much. Ochsner's a great partner. And I want to go down the line, talk about Pete, but let me tell you, I can't pass up Chuck Daigle. We couldn't do it over in the Northeast without him. Thank him. And of course, his wife used to run the state, and she was very good to me. Thank you, Brandy. Also, I don't want anyone to overlook that this has been hard work. And we had to put a lot of dedication, do a lot of things, change a lot of minds, and move in a lot of different directions. I want to thank our chancellor, Dr. Ghali. Thank you. That's another one. I didn't know when I first met him whether or not he would be able to reach the mark that we all expected. He came over to Monroe. I couldn't understand why a man with that great talent and that ability and know how to deal with people wouldn't go maybe to heaven. But he'll get there later. But thank you, Dr. Ghali, for your hard work, too. Also, we've talked about legislators, but I want to mention legislators. You've got a great bunch of legislators throughout this state, but you really have some very good legislators from Northwest. I hate to say, like that, but we have a great bond in North Louisiana, and I thank those groups like the one that will follow me up here. He's one of a kind. You have to be quiet. But Senator Tarver played a unique part in all of this, and I thank him personally. He's a dear friend of mine. He's a good man to have on your team. So give him an applause. And as I finish on the last page, I would like for you to know that our board members that make up this compact, this partnership between Ochsner and LSU, many of them here today. I see Carolyn Hunt from our area, but I see others across this Northeast area. You have, I think, the best leadership group you could have. And I want to thank Dr. G for her continuous effort in promoting health care in Louisiana, and certainly our president of the university. Go Tigers! Thank you. And I met that governor.
I'll be short. Come on, Senator. I'd like to invite the one and only Senator Gregory Tarver.
Thank you very much. It was good to have my good friend come before me. We've been in the legislature a long time. I'm not as old as he is. I'm much, much younger. He's the dean of the whole legislature. I'm just the dean of the Senate. It's nice and happy to be here at LSU. I want to first thank the governor for doing this for us. And I want to tell you that my whole family and I voted for you yesterday. And so you have a lot of votes. You know, I tell people all the time, I've been in business. My family, 122 years in mortuary business. If you need some more voters, I have a lot of them. And I use them every 4 years. It's a pleasure being here at LSU. I love LSU. LSU happened to be a lifesaver for all of us, for all of North Louisiana. I know because I was a patient here many moons ago, and I was a patient here not long ago. The only hospital that I go to is LSU here in Shreveport. I don't talk the talk, I walk the walk. I believe in LSU, I fight for LSU. Two people I remember years ago where all of a sudden this place didn't just jump here. I remember people like Bubba Raspberry who fought for LSU in Shreveport, and I think that we ought to thank Bubba Raspberry. We're missing a lot of people who fought, who was on the Board of Regents, and we usually forget these people once they pass away. Gus Majalis fought all the time for LSU. And let me tell you something. At that time, it was not an easy fight because we were a part of Texas being in North Louisiana. And they used to tell us that all the time. Another guy who was very good here was Dr. John McDonald. They ask me all the time, say, Greg, why you love this man so much? I say, he only saved my life. That's why I love him so much. But I thought that once he passed away, I would not get them calls at 11 o'clock at night anymore. But I was wrong because Dr. Ghali took his place. And he called you and very, very clear. Everything he says, I won't, I won't, I won't. I go to the governor and say, Governor, we need. And it's always a pleasure working with people who love LSU. And I'm here to tell you that Dr. Ghali loves LSU. He work at LSU. He fight for LSU. And I'm gonna tell you, and he worried the hell out of people for LSU. And there's nothing wrong with that. And I hear that Dr. Alexander said that, I told you this place was not going to move. But I didn't believe it until I heard it from the governor. Because let me tell you something. I understand Louisiana politics 101. He is the boss. He is the boss. And I want to say by Francis, who's a very close friend of mine, he and Alario are fighting each other. Who will be in the legislature the longest? Right now, it's President Alario been in the legislature longer than anybody. Now, he's running for the House. He's in the House. Now, he's been there, he and Alario been there since PBS Pinchback. Just in case some of you all don't know who PBS Pinchback was, he was the black governor of Louisiana. That's how long they've been there. It's an honor and pleasure being here. And I want to tell you, Dr. Ghali, you're doing an excellent job. You're doing an excellent job for all of us. You spare nothing. You have the time, you have the patience to put up with all of us. And let me tell you something, we have the patience to put up with you.
Thank you, Senator. Thank you very much. At this time, I would like to invite our platform party over to take part in the official groundbreaking of our Center for Medical Education.